This is a video on how to use the Medicare Drug Plan Finder to help you find the best Medicare prescription drug plan for your particular situation. My name is Abe Wishnia, and just so you know, I'm a registered Medicare counselor with the Health Insurance Counseling and Advocacy program in Santa Clara, California. It's part of the federally funded State Health Insurance Assistance Program, known around the country as SHIP, which is a free program to help people navigate Medicare by providing free, objective, and unbiased Medicare counseling by phone or video conference or in person. The program is not affiliated with the insurance industry, and we will not try to sell you insurance. The contact information for the program where I volunteer in Santa Clara County is on the screen. You also see on the screen the contact information for the program in other parts of California and the website for finding the program in other states. All right, so let's dive in on how to use the Medicare Plan Finder. The first thing you need to know is that you should go to the official Medicare website. As you see up here, Medicare.gov. Don't go to Medicare.com, don't go to Medicare.org, or Medicare.anything else. Those are going to be private websites owned by someone who's trying to sell you something. The one to go to find your prescription drug plan is the official Medicare website at Medicare.gov. Now, this is the way the landing page looks on the day that I'm recording this in March of 2026. But every few months, they change the person or people in that picture. So when you go to click, it might look a little bit different. But whoever is in the picture is almost always, not almost, always standing right here behind this banner that says Find Health and Drug Plans. And that's where you want to look. The green bar at the button says Find Plans Now. Click that. That takes you to a page where you enter your zip code. And the zip code is important. I'm going to enter mine because the prices that you see in the plans that are available will be different depending on where you live. Click Continue. Now, it takes you to a similar looking page where you select the kind of plan you want to research. And you can use this also to compare Medicare Advantage plans, to compare Medigap policies, also known as Medicare supplement plans, or, as we're going to do today, look at Medicare drug plans, Part D for drugs. You click that button and click Find Plans. Now, it comes to a page. This focuses on people who get financial assistance because of low income and asks, do you get assistance from any of those programs? And if not, you click I don't get help and continue. Now, tell us your search preferences. Do you want to see your drug costs when you compare plans? And you should always click yes. The reason is, depending on the plan, the drugs, the pharmacies, the costs can vary quite a bit. And you want to be able to see the costs of the drugs so that you know that you're making a good selection. So click yes and click next. Now, here's where you have to do a little bit of work. Before you do this, you should have lined up in front of you a list or the actual bottles of all of the prescription medications that you're taking. Don't put in over-the-counter medications, just the medications that are prescriptions that you get at the pharmacy by prescription, because you're going to need to enter the name of the medication, the dosage, and the frequency. So for this particular demonstration, I picked 4 of the most commonly prescribed drugs for people who have Medicare. So I'm going to use those as an example. So the first one I'm going to put in is a very common statin, simvastatin, S-I-M-V-A, and it comes to the drop down and there's simvastatin. You can click it and click Add Drug. Now it gets you to the dosage questions and frequencies. So there are different dosages, and I'm just going to go with the one that comes up first, but you could pick 5, 10, any of these depending on what you take. So let's assume it's a 20 milligram tablet. You take one a day. You could either click 30 every month, or you could click 90 every 3 months, which some people do just for convenience. So I'm going to do that and click Add to my drug list. shows you what you've entered, lets you confirm it. If you need to edit it, over here, you can click Edit the Drug, and it'll take you back to that previous page. If you want to remove it, you said, oh, I should not have put that in, you can remove the drug. But I have 3 more to add, so I'm going to click Add Another Drug. The next one I'm going to put on here is Eliquis, E-L-E-Q-U-I-S, E-L-E-Q-U, didn't quite come, I-S, there's a drop-down. Click Eliquis, add the drug, the dosage. So 60 every 3 months, 2 a day. So let's say you want to get a 90-day supply. That would be 3 times that. That would be 180 every 3 months. Add to the drug list. Again, confirm that you entered the right thing. Add another drug. This time I'm going to add a drug called lisinopril. L-I-S-I, oh, I have to click in the box, L-I-S-I-N, and look, the drop-down shows me lisinopril. Add the drug, and I'll just assume that's the right dosage for this example, and again, 90 every 3 months, add to my drug list. Now, I'm going to add one more that I know is an expensive drug and not all the prescription drug plans cover. And so I want to do that so you can kind of see how that would show up on your plan search. And that drug is Xidra, spelled X-I-I-D-R-A. There's Xidra. Add the drug. And I'm just going to assume that's the correct quantity, and 3 every 3 months. Add to my drug list. Okay, we've looked at those. Those are the ones we want to use. So if we're finished adding drugs, the green bar at the bottom left says Done Adding Drugs. You click that. Now it's going to take you to a place where you need to choose pharmacies, because the cost of the medication can vary depending on whether the pharmacy is in-network or out-of-network for a particular plan. And just because a pharmacy is in-network doesn't necessarily mean it's the least expensive. So I suggest to people always click mail order, because sometimes that's the least expensive way to do it. Then click some competitors like CVS and Walgreens compete fairly fiercely. And if you are a member of one of the big warehouse clubs, such as Costco or Sam's Club that has a pharmacy, in this case it shows a Costco here, so click that. Now you can add up to 5, but I'm using 4 here just to keep this thing moving. Once you've added the pharmacies, click Continue to View Plans. What this does now, it takes you to a page, a list of the plans, and the program, the Plan Finder, accesses the information that the prescription drug plans have filed with Medicare, the combination of premiums and copays for the various medications. And it sorts them by the lowest, over here on the right, the lowest drug and premium cost for the balance of the year. And you don't want to go just by premium, just by drug cost. It's the combination that matters. Now, as I said, I'm recording this in March, so it's going to show me the costs for the balance of the year for 9 months, not 12 months, the balance of the year. So if you were doing this in March and click this, your coverage would begin in April, and it would show you the costs of April through December, 9 months. So this particular plan shows a $5.70 premium and a total cost for the year of just under $2,146. Look at the plan details. It shows you that your drugs are covered, covers 4 of the drugs, and it shows you that your pharmacies are in network. But let's go back to the search results for a moment. It shows them in ascending order from least costly to most. So I'm going to try to scroll and hope this doesn't make your eyes sore, but as you go along, see how the premiums and the costs are going up. And now they start to jump rather dramatically. And that's because of the much higher premium. And while this plan has a 0 deductible, and this has a $615 deductible, your out-of-pocket costs are greater. Don't buy the plan just based on because of the familiarity of the name. Here, for example, one of the more popular name companies with the drugs. But look how much more your drugs are going to cost just for going with that name. And look, this only has 2 stars. The one with $5.70 premium has 3.5 stars. But look at this. If you want to know why this is so expensive, click Plan Details. It shows only 3 of the 4 drugs are covered. What's not covered? Scroll down. Shows you that the Xiidra is not covered. And look how much it would cost you if you pick that plan just because you like the name associated with it. So you want to go back to the search results. Scroll back here. Let's go back to this plan. You notice this one has 3.5 stars. In my role as a counselor, I advise people, if they can avoid it, not to pick a plan with fewer than 3 stars. The stars are not Yelp reviews or like Amazon reviews. The stars are a grade given by Medicare to that plan for how it has performed against various kinds of metrics. And there's a reason it's gotten a low grade. If you pick that just because, and ignore that, you may find that you have problems with it later. But so let's say you go with this plan, $5.70 a month. Let's look at the plan details. You scroll down. Shows you what you entered. If you decide you need to change what you entered, for example, you want to eliminate the Xiidra, you could click Change Drugs. It'll take you back to that page where you entered the information. Likewise, if you want to change pharmacies, you want to add one other one to see what it's like, you can do that here. But it shows you the pharmacies that we put in are all preferred and all in network. So now let's scroll down and it'll show you what your drug costs are by pharmacy at each location. And so you see, for example, the Eliquis costs you about the same wherever you go. The lisinopril will have a 0 copay wherever you go. The simvastatin is 0 copay wherever you go. The Xiidra is going to cost you about the same. So it looks like this is what you're going to pay for your drugs. Now, notice that it comes to just under $2,100. That's because in 2026, Medicare has a cap on your out-of-pocket costs for copays, not premiums, copays, for drugs that are covered by your plan of $2,100. Once you hit that out-of-pocket maximum of $2,100 for your covered medications under your plan, then they won't charge you any more copays for the balance of the year. So that's why you see this weird little amount capping you out there. So if you like what you see, the easiest way to enroll, over in the far right, there's this green button that says Enroll. You click that, and it will start you on the process. And I will tell you, by far, the easiest way to enroll in one of these plans is to do so online. If you do it online, you can get it done in 10 minutes because it starts with the information that you've already entered here. If you decide to enroll by phone, which you can, that button will show you how to enroll by phone. If you decide, here's the member number to enroll by phone. You see here the plan website, etc. If you decide to enroll by phone, it can take you an hour or more, depending on the number of medications you have. So my recommendation, enroll online. And if you enroll in a given month, your coverage then typically is effective the first of the following month. So that's how to use the Medicare.gov Plan Finder. And this is really where you should go to search for any of these plans. And of course, if you have trouble with this, if there's something you don't understand, if you get these weird answers, or you can't find your medication, or you just need help with this, contact the Health Insurance Counseling Advocacy Program here in California or the SHIP program in your state and ask for a free phone or in-person appointment with one of the counselors. The counseling sessions are free and not affiliated with insurance companies. No one's going to try to sell you anything. Instead, we're going to try to give you the best information to help you make the best choice for your circumstances. So with that, thank you for watching the video, and the contact numbers for those programs are here on the screen.